All right, crew. This is episode number 5 of the Active Oakland podcast. And today I'm joined by Dr. Colin Miller. How's it going, Colin?
How's it going, Mike?
Good. So Colin, he's a therapist with us at Pro+Kinetix, and this is the first episode he's on. So let's just let him give you guys a little introduction about him and his background.
All right. Well, this is my first podcast, so I'm a little excited about it. I graduated my undergraduate from University of Northern Iowa and then went to graduate school to get my doctorate in physical therapy at Clark University. Did a little bit of traveling physical therapy for a while and then ended up here in Oakland and started working at Pro+Kinetix with Dr. Ben. We met a long time ago, back in the day. We actually grew up in the same town, so we've known each other for a long time. But yeah, so I've really been loving the Bay Area for about a year and a half now, and probably not leaving anytime soon.
Good. Yeah. You guys are Iowa boys, right? So.
Yep. Born and raised, that Midwestern hospitality.
Yes, sir. Yes, ma'ams, all that good stuff.
Yeah, it's Montana, though. I guarantee that. I guarantee you got all that hospitality going on there as well.
Yep. Yeah, all the Pro+Kinetix crew are all small town folk, but yeah. So today's episode, we're going to talk about something that Colin and I both deal with very, very frequently, and I'm sure many of you have experienced this in your either training time or just lifetime, is low back pain. Low back pain is very, very common. The statistics show that 8 out of 10 of us are going to experience it this one time or another. So we kind of want to just dive into it a little bit, share some stories we've had with our clients, and maybe clear up some false information or some things that people might have some beliefs around low back pain that may or may not be true. So I think first would be good to just kind of paint a picture of it. Like if you kind of share a story, Colin, about experiences you've had working with patients with low back pain.
Yeah, no problem. Most patients, the majority that you're seeing are going to have some type of involved back pain. Like you said, 8 out of 10 of us usually have back pain. And it's one of the most debilitating injuries that we find in the physical therapy world. One of the ones that sticks out to me the most was a gentleman who had a 4-millimeter herniated disc. He had radiating sciatica symptoms, which is, for those who don't know, is like burning, pain, tingling, numbness that comes down from our back. And if it's bad enough, can go all the way down your leg, all the way to the foot. And he had past the knee all the way to the foot, which is usually a very bad sign that's a quite herniated disc. He was told by, physicians that he's going to have surgery, either that they're going to have to cut into that disc or they're going to have to work on his spine and maybe do a fusion of some sort. But he wanted to, take the chance and try physical therapy first. So when we started seeing him, he could not stand up straight without having serious pain. He would hobble kind of in, was almost thinking about having to use some type of cane or something. And this is a younger gentleman. We're talking about mid-30s here. Injured himself doing some heavy deadlifts, and then also re-injured himself kind of in a weird twist motion when he was lifting something a couple weeks later. So kind of just made it worse. We worked with him. We got his motion back, got his strength back, got him to the point where he was standing and walking without any pain. We kept working on as Mike has his strength and conditioning. So do we. And we got into that strength and conditioning and got to the point where we're back to deadlifting. And he's a big kickboxer, and we're kicking the bag, and we're doing all these twists, and he's able to move fully, and he's back, and he's got his life back, and he didn't have to have any type of surgery or go through any expensive and big ordeals where they're cutting into him. So it's one of those things that you can be told the worst by, all these professionals, right? If you have no medical background, whatever a doctor says, usually you take it to be the truth. And we just want to make sure that people know that there are other options out there, right? We don't have to get under the scalpel necessarily. We can always try more conservative measures. And in Pro+Kinetix, especially for us, we see a whole lot of lower backs from our athletes that are doing deadlifts or doing some type of fighting or anything, running, and we get them back to the things that they love to do. So definitely always know that you have other options, and know that Pro+Kinetix is definitely one of them.
Yeah, and I think you bring up a really good point. I think the research now is more supportive of it, and it's I think it was a very common misconception that when things like a disc bulge happen, for example, right? And if you imagine what's happening is that disc is actually like pulsing through the nucleus pulsus through that fibrosis, like annulus fibrosis coming through and pinching onto the nerve. Like obviously there's like structural damage, so like how is that going to get repaired? But I think now what we're kind of finding that conservative management actually can and will like help that disc reabsorb and kind of avoid that surgical option. Do you find that you still find that that's like a common belief out with patients is like, hey, I have a disc bulge, is my only option surgery? And like, how do you kind of tell them about like, going around that instead of taking that surgical option?
Right, 100%. Yeah, I see that all the time, that people, they know that there's something structurally wrong or someone's told them that, and then they automatically think, okay, it's wrong, I have to get it repaired through surgery. And what we do is, to kind of talk people and give them that education that your body heals yourself, right? Your body is going to help reabsorb that fluid that is around that spinal nerve, and it's going to help heal that herniated disc itself. What we can do is put you in the best position and strengthen those muscles and structures around it so that it heals even at a faster rate. If you kind of go about it and just sit around all day, you're not going to strengthen anything. You're not going to get that mobility back to help kind of coax that healing and kind of help get that disc back to where we want it to be. So movement is a huge thing that can help us actually get the disc back into place, where a lot of people, when they hurt their back, they go the opposite route. They stop moving at all. They start moving less, and they want to just almost be like robotic because they're worried that they're going to hurt themselves. And we actually want to get them moving more and get those motions back that they're missing, because that's what's going to help that disc get back to where it needs to be. So yeah, a big proponent of education for our patients, because the more they know about anatomy and the more they know about science and everything, the better they're informed, and the better decisions they can make about their own bodies.
Totally. And then you had mentioned before, so your client from before had been deadlifting, correct?
Yes. Yep. He'd been deadlifting with incorrect form.
That's what I was going to ask next is like, so people are maybe going to listen to that and be like, oh, deadlifting, back pain, cause of disc herniation. Like, is that a correlation? Does that mean that deadlifting is per se bad for your low back? Or is there, as you were kind of saying, maybe there's more to it than just deadlifting equals bad for your back?
Right. So, I mean, that's a great point, right? I said deadlifting, and now people think, oh, shoot, I shouldn't deadlift, right? I could get a disc herniation. Totally false. The gentleman that we're talking about was deadlifting with terrible form and way too heavy of weight. If you do anything with terrible form and too heavy of weight, something's going to give, something's going to go wrong, right? And that's a big proponent of Pro+Kinetix, is we train those correct movements, those functional movements that we do every day: squatting, deadlifting, lunging, right? If I go to pick up a pair of shoes off the ground, I got to do one of those three things to pick it up. If I do that wrong 4 times a day, 365 days out of the year, that's just micro damage that adds up. And then I go and do a heavy deadlift wrong, and then the straw that broke the camel's back, right? Herniated disc. So that big proponent of teaching our patients the correct form and using those correct muscles is huge, and will actually keep you from getting a herniated disc or keep you from getting injured, because you are using those correct muscles. Because if you can deadlift your own body weight correctly, or even more than your own body weight, it's always a goal for us is at least your body weight when you leave us. Anything out here in the real world, it's not going to bother you. If you can do that kind of stuff with proper form, nothing out in the real world is going to cause any damage. It'd have to be some serious type of chaotic thing. So we always want to bulletproof people for when they're out in the real world, right? We're putting them through stressful situations with correct form that strains your body parts in the correct manner, and then you are bulletproofed, and you're kind of ready to be out there in the real world for just about anything.
Yeah, no, I 100% agree. I am a huge proponent, and I believe that, there's nothing there's not a better exercise to make your back like more resilient than the deadlift. And to demonize it is just like kind of, it doesn't really make sense, because it's like you were saying earlier, such a fundamental movement. If it deadlifting is bad, then that means, you know, picking up your kid from the ground is bad. Or when you're picking up, you know, a heavy grocery, it's like, if taught correctly and done in the right way, it's like that is the role of the back, is like supporting those kind of movements where you're essentially just, do not pick up stuff from the ground. Like that's what we're doing. And it's, and the deadlift, as in like, if you're going to do it like, you know, kettlebell, barbell, whatever implement you're using, it's just a teaching tool. It's like training for the real world. Being able to pick something up from the ground. That's what we do when we're deadlifting. So you try that, you experiment with that. You're learning how to use the right muscles with a good coach or a good PT. And then, yeah, you're bulletproofing your back and transferring that. So when you're doing the real world, you're going to do it with a proper technique without putting that extra stress on the back.
Exactly.
Another one I commonly hear, aside from deadlifts, is people saying squatting's bad for your back too, right? Loading up all that weight on your back and then going down to a squat. And you will hear, right? You've heard that guy. It's like, oh, I don't squat anymore because maybe my back hurt from that, or knees or whatever. So it's like, is that the same kind of scenario as the deadlift? Is it another lift that's kind of falsely been accused of, like what causes low back pain? If you squat too much or do that too frequently, that's going to obviously hurt your back. Or
you hear that all the time as well. As doing heavy back squats, for sure you're going to have back pain. And most of the time we see any back pain occur from squats is because of people's hips. Yep. They don't have the mobility, they don't have the strength, they're not using the correct form of their lower body. So what takes on the brute force because they're not using the lower body correctly? Your back, right? If you're not using your feet correctly, if you're not using your hips correctly, if you're not using your knees correctly, it's got to go up the chain somewhere and find something to help it. So it's going to look towards your back to get stability. And if your back's not supposed to be doing that type of thing, it's going to obviously give. So we see a huge thing, especially with our squats, is fixing ankle motion, fixing hip motion, and using our glutes correctly. And you have absolutely no reason to ever be worried about your back whatsoever, because you're engaging your core, you're engaging your glutes. That should keep your spine in a correct position at all times through the whole movement. It should never even move. So there should be no issues with doing a back squat with back pain. But again, the thing that gets demonized as soon as you have someone with back pain, oh, no more squats, right? Which we find is ridiculous, because a squatting is a function movement that you have to do for the rest of your life. Going to sit, getting up off the toilet. These are squats, people, right? So we got to be able to do those movements, and that's the deadlift and the squat are the two biggest things that we ever teach when it comes to back pain. So getting people back to those functional movements and doing them correctly, should be one of the biggest priorities for a physical therapist. And sadly, you don't see that. You don't see that in the physical therapy world, which is sad. And I'm hoping as we move on in this future that you start to see that a whole lot more.
Yeah, and I don't know about you, Colin, but I don't know about your experience like during physical therapy school. I don't know if you had much coaching or training around the movements like deadlift, squatting, or even how to coach Q, or even watch that for proper formic technique, right? I actually had the reverse, where they were again proponing that deadlifts are a harmful movement. They had this graph that's showing like all the different positions of your spine and which ones would put the most stress on your spine. And it's like in this hinged position, like a deadlift where you're bent over, it's like, see, look at all that shear force on your spine, AKA like harmful. At the same time, if with improper form or too much weight, like you're talking about before, yeah, but that stress, that's like how you build resiliency and strength. That's just saying like, when you're curling, it's like at this certain angle, it's like the most stress on your bicep. It's like, yeah, because I'm trying to build my strength in my bicep or trying to build that muscle. Same thing. It's like that deadlift is targeting the back in a way to strengthen it, and done properly is the best way to strengthen it. Because that's just sitting, like you said, like avoiding a movement or trying to avoid like bending or hinging and just kind of walking around like robots trying to avoid all stress on the back. It's like, then you're going to end up with this really weak spine. So what was your experience? Have you had a similar experience with school where you just weren't really given much information about those kind of movements, or even screening those? Or
so with school, not a whole lot of strength and conditioning coaching goes on, especially with your big prime movements. Luckily, all three of us have had a lot of sports background, a lot of lifting background. And so a lot of that came from that. And then learning all the PT skills, and I mean, we were able to kind of form them together and make this great program with cueing and making sure that you're doing all the right movements and having modifications for those that can't do certain movements due to restrictions of some sort, make it mobility, strength, age, whatever you want it to be. But yeah, not a whole lot of it going on in PT school. And which is you're missing out on something, right? Because even if your geriatric population, if I'm working in a some type of setting like that, 70-year-olds got to pick stuff up, right? So maybe it's a light kettlebell and maybe it's on a chair, but it's still a form of the deadlift, and it still needs to be taught because they need to be having if anyone, they need the strongest of muscles around their spine because everything's degenerated, right? They're losing their curve in their spine, so now the vertebrae are more stacked on top of each other. Now there's more pressure through already a thinned out disc. So if anyone should have back strength, it should be an elderly or a geriatric type of patient. So I think it's a big thing that's missed out. And if you do the sports program of a PT, you get a little bit maybe, but still I think it needs to be trained. I think if I'm being honest, I think all physical therapists should be trained how to physically do it themselves, be squatting, deadlifting, all these correct movements. And so I think that's something that's missed out that is needed to do.
No, 100%. I think that's why, like at Pro+Kinetix, we are selective of the people we kind of bring on staff if they have that kind of background and kind of walk the walk, like they actually engaging in these movements, know how to assess them. We all have like strength and conditioning certifications. Because if you ever go to a therapist and you're coming in for low back pain and it's from deadlifting, and they don't ever look at your deadlift, then guess what? You're never going to solve the root cause of that problem. They're never going to maybe give you that movement assessment and help you and coach you. Yeah, they might tinker around, do some core exercises, hit the glutes a little bit, kind of avoid everything that you've done before that caused that pain. But then what does that mean? Like you're abstaining from deadlifting forever. So you want to make sure you have therapists that can kind of speak the language with you and understand like and help you get back to the things you love. Because I know you're talking about with that client yet earlier. I can guarantee you in your rehab, you guys are deadlifting, right?
100%, 100% deadlifting. Yeah, that's the thing. You can fix everything. You can fix their mobility. You can fix their strength. You can fix their balance. But if they go back and do the same terrible deadlift form, even with all that fixed, they're going to end up with pain at some point. They're going to injure themselves again at some point because they're not doing that lift correctly. So if you come into with back pain from a deadlift, you need to be assessing their deadlift. If a runner comes in with back pain, you need to be assessing the running, right? They could have the back pain from running. So, I mean, whatever you're getting injured in, it needs to be assessed. And especially our population is more the athletic and sports population. So you got to have some type of knowledge about running, about lifting, about fighting, just so you can know kind of what the positions that people are getting themselves into so you can correct them.
So what is your typical process then when you're looking through, like you have a low back patient? Are you usually starting with like mobility or strength? Like how do you usually kind of run through like a low back assessment if they were to come like Pro+Kinetix?
Right. Great question. So we're always looking to mobility first. The first phase that we're always looking at is to get someone's mobility back. And why that is because if you do a bicep curl, right, and I only have half of my elbow motion, I can only work really half of my bicep, right? So I'm only doing half that motion. So you need that full mobility back to work, that full muscle. So mobility is usually our first phase that we're really looking at. Now, if someone comes in and they have a very unstable spine, of course, I'm going to get some stability work in there to give their spine some stability. Otherwise, they're just going to feel like they're kind of out there in the middle of nowhere and not able to have any type of structure. So, but mobility is definitely our key first. Always want to look at full extension, full flexion, side bending and rotation. The big proponent that we see for a lot of our clients, especially in the Bay Area, is we're missing extension. We're all sitting at our desk all day, every day on these damn computers, and we lose all that extension. We lose that tummy time that we had as a child to get that nice, what we call lordosis in the lower back. So extension is a huge proponent that we usually find for a lot of our back pain patients when it comes to mobility. And then we move over to stability, right? So the big proponents of having your back stabilized is your core, which is not your six pack, the rectus abdominis. That looks good. That's about it, right? It does a crunch for us, and that's about it. So the transverse abdominis and the multifidus, these muscles that wrap around your spine and protect your spine, those are the muscles that we like to focus on. And not only in stabilizing in a static position, but you need to be stabilized in a dynamic position as well with movement, right? I can stabilize all day in just this hold and be okay, but I need to be able to move and have that stability as well, because we're dynamic in when we're out in the world, right? When we're playing sports, when we're working out, we're moving. So we need to be able to be strong through movements. And then that third phase that we like to work through is the bulletproofing, which we kind of talked about already. We're making sure that we're back to deadlifting, or we're back to doing the things we love to do, and we're making sure those forms are 100% and that they're safe and they're correct and you're using the correct muscles. So that's how we usually go about, any patient we go about, but for our back pain especially, that's kind of the framework that we use.
Yeah, no, and I think all of those points you hit are excellent. And I think if people are experiencing back pain and say they've talked to a physician, or they feel maybe just discouraged because their back pain hasn't gone away, I would really strongly recommend that you see somebody or go through that whole process that Colin kind of described before you decide even close to doing something like, getting leaning towards a back surgery, or staying kind of on those pain medications, which is obviously another huge issue that people go through with low back pain, is the getting addicted to pain meds and stuff too. So I think that process that Colin described, that you have to have at least tried that more conservative route and gone through all those steps before, you ever dip into those more extreme measures. So and I think that's something that Pro+Kinetix, that we really are huge proponents of. And I think that's something that we specialize and do a really good job of. I mean, not to toot our own horn, but we take you through that whole process, which I think a lot of the time, that tail end of it that Colin was mentioning earlier, was that kind of bulletproofing or resiliency. It's that performance side that I think a lot of people kind of get stuck in this loop because they don't ever get to that stage. You kind of can get out of pain, you can work on the mobility, but if you don't ever kind of work on that resiliency around your spine, I think people a lot of times, I don't know about you've seen it, Colin, they kind of end up having more frequent flare-ups again, like this back pain just keeps on coming back.
Yeah, we see it a lot, right? We get patients, 3 to 4 weeks, they're out of pain, they're feeling good. Okay, I'm good. I'm gonna go back and do my stuff, and I'll let you know if I'm having any issues. And sure enough, 2-3 weeks, you get the phone call, hey, I hurt my back again. Well, of course you did, because we didn't do the things to make you resilient so that you'd be resilient to these problems. So you got to go through the whole process, and it's hard work. And a lot of people don't know that, and they don't do that. When they come to physical therapy, they're thinking they're coming in, they're going to give me a massage, I'm going to do a couple stretches, I'm going to feel great. That's just not how it works, right? If anything's worth having, it's going to be hard. It's going to be tough. And you got to put in the time, and you should put in the time. This is your health you're talking about here. Nothing matters if you don't have your health. You can have all the money in the world, but if you can't walk, what the hell's the point of it, right? So you got to be able to, first of all, put in the time and put in the effort, and you got to want to do it, because it sucks. I mean, sometimes rolling and stretching when it hurts, or doing an exercise that really burns those glutes because you haven't used them in a while, you got to get it done, and you got to put in the work, but you'll see the results. And I promise you that. I let all my patients know, if you put in the work, I promise you're going to get results. So that's one of the biggest things when it comes to physical therapy, is it's not going to be easy, and you got to be ready for it.
Yeah, and then on the flip side of that coin, if you ever do decide to go down the route of like more of that surgical option and stuff like that, like there's that whole process to go through, which is that financial, and obviously like you're actually changing the structure of your back by going in surgery, which has other risk factors as well. And then you still have to go through rehab. So you still have to go through this whole process again.
You got to see us after that.
So you still got to see us. So I think, not that everybody that's listening is considering surgery, but again, even if you are, like, really consider seeing a therapist or having somebody assess your movement if you're experiencing back pain. And again, like, I would highly recommend you take yourself through those whole process that Colin was talking through. So yeah, Colin, thank you. It was great having you on. I'm hoping to have you on some more future episodes. It was great getting your insights about how you've managed low back pain, and sure we'll have future episodes about, we can kind of share, our ideas on how to manage these, but hopefully you guys found some value in that. And again, I really strongly encourage you to, if you're experiencing this back pain, if it's going on a long time, or you've been told that, surgery or something is the only option, that, whether it's us or any other PT, find somebody that knows what you do as far as those activities you enjoy, and will take you through that whole process, getting you back to those things that you enjoy as well.
100%. Couldn't agree more, Mike. I appreciate you having me on. I kind of like this podcast thing. Who knows? Maybe I'll do a couple more episodes here.
Yeah, we hope so. All right. Thanks, Colin. All right. We'll catch you guys on the next one. Later, guys.